treated a patient who came in with severe GERD or acid reflux. And what was interesting is she's had two different procedures, two separate times, a couple years apart. It's the TIF procedure, and essentially what it does is it constructs the valve between the esophagus and your stomach to help it keep the acid down. And that's usually the problem, is that valve doesn't work very well. And what's really interesting is she couldn't eat certain foods, and then even the food that she did eat, she would tend to have severe acid reflux. In fact, she was medicating every night just to keep from truly being in a ton of pain. And this is after 2 surgeries. After 1 session, I was able to keep all of her acid reflux gone for about a week. And what did I do? I treated the inflammation surrounding that valve between your esophagus, which is your throat, and the stomach. And whenever there is inflammation trapped in and around a specific structure or tissue, whether there's an artery or a nerve or a bone or a muscle, in this case it's a valve, it doesn't work properly. The nervous system doesn't work, it doesn't get the signal right, not moving well. And so what I did was I was able to release the inflammation out of that area, and it improved the ability for it to work. Now, there was a couple more sessions we need to do to make it more permanent, but I know it's been several months now since I've seen her. She's doing great. Very little to no acid reflux, not on medications. She's eating a lot more different kinds of foods, and a lot of that has to do with the fact that we're able to identify why her valve wasn't working in the first place. Now, does inflammation, is that the cause of every problem? No, but it's the cause of this problem, and it's very simple to determine whether or not that is the problem. I will tell you that this woman, she could have had most turmeric in the world and it wouldn't have fixed the problem. This is not something that you can modify food to fix in your GI system. This is something that needs to be mechanically removed, and there are very specific fascial techniques that we use here at Renew that address that very problem.